Well, it is National Poison Prevention Week. Hundreds of children under the age of 6 are taken to the emergency rooms every day. And it's not just chemicals, it's some everyday items that might be right there in your own home. Joining me now to talk about this, Brent Durking from NorthStar-EMS and Ann Slattery, Director of the Regional Poison Control Center. And we were just talking, we kind of got caught as we came back because there's so much to warn people about the things that are in their homes. Why this focus this week is so important?
We want everyone to be aware. Anything that you use frequently can be something that they'd be exposed to. Cosmetics and cleaning products are number 1 and 2 when it comes to household products that our children are exposed to. Also, medications, they're a really big problem because they can be some of the most serious.
We've got a few here on the table. And Brent, this is something, you know, parents may think about that, but when they go to visit grandma's house, you know, grandparents need to be aware of putting these things up as well.
Well, they do. Excuse me. And as Ann had mentioned, you know, we're really concerned about the medications, and a lot of these pills come in different colors. So when you have small children, you know, they might think of it as being candy or something that's going to be tasteful. So just a couple of props we brought was, you know, just make sure that if you have medications and small children around, that you're going to use containers that have the child safety locks where you have to push and squeeze versus the pop-off tabs, which makes it much easier for the child to get into. And then a lot of the scheduled pill containers that our elderly population use, you know, have colors on it as well, but these are very easy to get into. So you need to be very careful if you have these in the household as well.
What about some other things that maybe, you know, over the years you hear about a lot of different things, but sometimes there's something new that pops up that we just haven't thought about. Is there something like that right now?
Well, we are seeing an increase in the e-cigarette liquids. They come in little dropper bottles, and children are being exposed. And we also handle adults, and we are having adults unintentionally putting them in their eyes, thinking they're eye drops, things like that. So we've had a lot of exposures.
So anytime a new product comes out, there's always the potential for people misusing it or confusing it, or children getting into it.
Exactly. If it's in your home, there's the potential for a child to get a hold of it. But as we were talking about the child-resistant closures, they are a great product to use in your home because 38% of all exposures in children are grandparents' medications.
Coming down. All right. Thanks for being with us. We appreciate it. And for more information, you can go to WBRC.com. We'll be back in just a moment.